Hi everyone, my name is Ankita Patil and I'm an undergraduate student at the College of New Jersey. This summer, I focused on examining racial inequities in stroke incidence within Durham County with the guidance and support of my mentor, Dr. Dev Sangvi. Stroke is the leading cause of death and disability in the United States, with Black Americans facing the greatest burden of the disease when compared to white adults. Disparities in outcomes are reflective of non-biological factors, such as proximity to clinics, environmental stress factors, access to physical activity and healthy foods, education level, governmental approaches and policies, and other social determinants of disease. There is limited research on how incidence of stroke varies by race in different geographical areas that are close in proximity. The purpose of this study is to analyze racial inequities in stroke incidence within Durham County. The objectives of the study include to compare stroke incidence rates by race in 8 Durham communities, to recognize the individuality of each community and the importance of working with stakeholders, and to determine how to engage with the community to help empower it with data and awareness. The approach taken for data collection includes choosing communities based on the most populous census tracts in Durham County as sorted by geographic location, which include East, West, Northern Durham, North Central, Central, Southwest, South, and Southeast Durham. Stroke rates are based on healthcare visits documented in a combined dataset, including a total of 169,115 adults of a countywide total of 245,572 adults in 2017. Trends in incidence were measured from 2015 to 2017. To understand each community's access to resources, the social determinants of health data was collected from the Durham Community Health Indicators Project as reported in 2017. Findings are summarized into 2 figures. The first figure demonstrates racial stroke trend differences from 2015 to 2017. It can be seen that for certain tracks, such as track 3.02 and 20.27, that the trend for stroke incidence decreased more for Black adults than for white adults. However, for the majority of tracks, the trend for stroke incidence decreased more for white adults than for Black adults, with some tracks further showing an inverse relationship, such as for track 17.09. Track 17.07 is an example of how stroke incidence rates decreased at the same value for both racial groups and shows how the action taken in that community benefited both Black and white adults at equal rates. Figure 2 showcases the percentage of the population in the selected track that has access to certain resources. However, despite similar environments with access to the same amount of resources, such as grocery stores, parks, and air polluter proximity, racial inequities in stroke incidence were still observed, demonstrating how social determinants of health disproportionately affect Black adults. Although the data used for this study is from a short time frame of 2015 to 2017, this unique study supports further investigation into the role of social determinants of health by race through the use of publicly provided data. The study also provides knowledge that can support health policy implementation when establishing future directions and identifying barriers to care. I would like to thank my mentor, Dr. Dev Sangvi, Angel Romero Ruiz, and Marcy Fusen for their guidance and support throughout the study. The data is from the Duke Health and Lincoln Community Health Center provided by Duke Center for Community and Population Health Improvement. Thank you.